Super. Thank you.
So, good morning, Senator Hewitt, and thank you so much for doing this little interview conversation with us today at Disability Rights Louisiana. We wanted to do these informal interviews with candidates so that people with disabilities and in our community can be more informed on the issues that might impact them. So, I am going to start out with our first question, but I really want you to take this conversation, Senator Hewitt, and tell us a little bit about what you do.
Well, thank you so much. Thank you for reaching out and giving me an opportunity to speak directly to the disability community. Just to give you a little bit of background on myself briefly, I grew up in Lake Charles. I live in Slidell now with my husband. We've raised our two sons here. I'm a graduate of LSU. I went to school there and studied mechanical engineering, went to work in the oil and gas business, where I was a senior level executive there at that company before leaving because our third grader was struggling with his multiplication tables. And I thought that it was because I was traveling too much and not home enough. And so we were able to tighten our belt and make the decision for me to come home and be a full-time mom, where I got involved in our schools and our community. And then when our sons grew up and got jobs and went to college, I began thinking about what's next for me and chose to run for office because I felt like our state was heading in the wrong direction. I've been serving in the Senate now for 8 years. And one of the biggest blessings for me, honestly, has been for me to get to know the disabled community. I served in my first term on the Senate Finance Committee. I serve on the Joint Legislative Committee on the budget now. And so much of the disability issues that come before the legislature is related to funding of programs and services. And it has really opened my eyes to the great needs of the disability community. And through that, of course, I became more aware of people that live right here in my Senate district that have disabled children or adults that are disabled who are wanting to work. And what I've come to learn about the disability community is that, first of all, they want to be contributing members of society. Those that are able to work want to work. They want to be given opportunities like everyone else to provide for their families and to work and to have meaningful things in their lives. There are some, of course, who are not able to work, and it is a responsibility of all of us to provide the services and the resources and the support that they need to be the very best that they can be, because that's what they want, and that's what we all want. And so it has been really one of the best parts of my job in the Senate. Quite often reporters will ask me, what is the thing that you're most proud of in the legislature, of the things that you've done? And I've done a lot. I've passed over 125 bills, which is extraordinary in an 8-year term. People say, what are you most proud of? And I probably am known a lot for the education work that I've done and some of the fiscal work that I've done. But what has made me the happiest, quite honestly, is when you feel like you're making a difference in the lives of the people that you serve. We're able to do that through our constituent services. And I feel like I've been able to do that through some of my work on behalf of the disability community. So, for example, I have been involved, in authoring legislation that allowed us to increase the rates for direct service providers, or professionals, direct service professionals or direct service workers for home and community-based care. I, again, became very aware through friends that were taking care of their loved ones in their homes that it was very difficult to hire people for the small amount of money that we were paying them. They certainly had other, options with higher pay, and it was very difficult to get people. And so increasing the rates has helped a lot. We did some rebasing work over the last few years as well. Those were all really important measures. I was involved in kind of the revamping of the waiver program so that we didn't have, such a complicated system, and people were able to get waivers for the services that they needed, and not maybe in the past they were, getting services or had the opportunity to get services they didn't need, but were tying up funding that could be used by other people. And so I think the waiver system that we have now is better. Last year, I passed a bill that allows funding not just to go to waivers, but other disability services. I think that was a very important piece of legislation. This past year, I passed a bill that allows the disabled community to participate in meetings of boards and commissions around the state remotely, so that they have more access to the work of their local and state governments. And I thought that was very important. And so I have had the opportunity to do some things, because the people in my district and those that have chosen to come to the Capitol and testify at some of our legislative hearings have opened my eyes to the great needs of the disabled community. And so it's given me an opportunity to do some things over the years that I'm very proud of. Can we do more? Absolutely. And as governor, the one thing that I know is that I will make sure that the Department of Health is being efficient and fair in the money that we are giving them for the mandatory services. As you all know better than anybody, what happens in years of a budget shortfall is that, the first thing is we talk about cutting healthcare and higher education, and those that are, receive, quote, optional services in the Medicaid programming are always the first on the chopping block. And it shouldn't be that way. You guys should not have to come to the Capitol, kind of begging for funding that you need for critical services. And really, that is so unfair, in my opinion, because I don't think the Department of Health has always done a good job of defending the expenditures that they're asking for the, quote, mandatory programs. And if we were a little bit more diligent in working those numbers, I think there would be additional revenue for the, quote, optional services that are so valuable and so important. And so, I've done some work in that area with the Medicaid Estimating Conference that I chair, and many other things where we're trying to bring more clarity to the budget for LDH, so that we can stretch our dollars as much as possible and address all the issues of the community as efficiently and as fairly as we can.
You've done some really amazing work, and as a person with a disability that receives services, and as an employee of Disability Rights Louisiana, we are so thankful. I know you talked a lot about waivers and people with physical disabilities, but what is your assessment of mental health services in Louisiana? And is there anything you would plan to do as governor?
Well, thank you. I mean, our mental health resources are abysmal in our state, and not just for the disabled community, but for everyone. I mean, we are so lacking in mental health resources. And so that's a huge need across the state. We have to really come to grips with that, I think, as a state, and start making some significant investments in that area. We do have Safe Haven up on the North Shore, where I am, that is working to become a little bit more of a one-stop shop for mental health services. We know that what's happening around the state is that, people that are having a mental health crisis, quite often end up in the emergency room or in jail. And that's not really a treatment. That is a temporary thing, and it's not fixing anything. And so we have to do a better job of providing mental health resources to so many of our citizens, including the disabled community. And so that's probably, I think, one of the biggest needs across the state. And it's growing as we are continuing, to come out of the public health emergency. There's so many needs. Our senior citizens have great needs as well, as they suffer from isolation and other issues. And so, we need to put together a program of mental health and a long-term commitment to funding that. And so I would certainly be open, to any of your ideas, you as a group, on how we can do it. If there are states that are doing a good job of that, I don't like to reinvent the wheel. So if there are people that are doing it well already, I would love to know that, and for us to begin with a model that we know works.
We would definitely love to work with you.
Well, my door is always open for that. So any input on any issues, it's helpful to me, right? Because I don't have immediate family members that have disabilities, and so it's very helpful to me to have input from those that are caregivers or that are disabled, so that you can guide my thinking and help me make sure that we're responding to the needs of the community.
Well, we will definitely remain in contact with you. But is there anything else you would like to add to our community?
I think we've covered quite a bit of it. Again, I feel like the disabled community is part of my family, part of my heart. You've stolen my heart. And I have watched children grow up over the last 8 years that I have become attached to, that have had families that have been active and advocating for disability issues. And I have such tremendous respect for the community and the caregivers, and just know that you always will have an open door with me in making sure that we continue to work towards doing a better job of delivering services. And I feel like we've made headway, but there's so much more work to do, and I need your help to do that.
Well, thank you so much for everything you've done and that you're continuing to do, and I hope you have a nice day.
Thank you. You as well. I appreciate the opportunity.
Thank you so much.
Thank you.